liposuction consultation, whenever the client comes to me for the liposuction, they ask mainly two things. One thing is, what is the complication? Doctor, first tell me the complications. Second thing, what they want to know is it safe? And why every person coming for the liposuctions asking these questions? Because of lot of influences, external influences. First thing, the whatever bad happens in the cosmetic surgery or liposuction, it was so much hyped by the media. So when the media hyped the lot of complications in the liposuction, obviously it goes into the each of the client's mind who wants to go for a liposuction. Second thing, if anything goes wrong, what others speak about it. Okay, this is the major concern of most of the clients who are coming to us. We are not bothered about us, we are bothered about what others speak about the complications. Okay, now we see the rarest complication what we can see in liposuction. The first complication, I will come from the deadliest complications, example, death. If you take the history of liposuctions, initial stages, yes, 1 in 5,000 cases deaths are reported in 1990s, I am talking about. But advancement of the liposuction instruments and advancement of the anesthesia techniques, now it is in 1 in 50,000 to 1 in 1 lakh, that too when it is done by the untrained professionals or it done in a very small setup where there is no facilities available. Say example, a medical spa or a small place, small clinic where there is no emergency equipment are available. So if you consider this incident, is almost always negligible. So if you consider these things, it is very safe procedure. What is other complication, what commonly talked about is the fat embolism. Even in my earlier videos I explained about the fat embolism complications. What is fat embolism? Everybody will be confused what is fat embolism. Usually when there is a road traffic accident, there is a crush injury over the thighs, the major bone got fractured and because of the fracture the nearby blood vessels also injured, and so big fat particles enter into the blood vessels and go into the lung vasculature and obstruct the lungs. This is called fat embolism. Then what is the relation between liposuction and fat embolism? See, what the theoretically what others claim is, when the liposuction the cannulas goes and rupture blood vessels, nearby fat goes into the blood vessels and obstruct the lungs. That is the theoretical possibility what others talk about. Why it is initially happened? Even few liposuction, yes, fat embolism happened. What is the ratio? What is the reason for it? Earlier days they use a sharper cannulas where the chance of blood vessel injury is common. But none of the plastic surgeons now use the sharper cannulas. They use a very blunt cannulas. Even if you want to puncture a blood vessel, it is difficult. So the chances of blood vessel injury is extremely rare in a liposuction. If that is the case, where is the chances of fat embolism? Even if it injures blood vessels got injured, injured blood vessels in liposuctions are very, very small blood vessels. The small blood vessels won't have the capacity to accept the big fat particles. So even fat embolism happens, it will be a very mild form, it is very unnoticeable. In our experience of almost 4,000, 5,000 cases of liposuctions, we have seen only 2 fat embolisms. Even 2 fat embolism, 1 fat embolism, we observed him overnight with the oxygen supplements and we discharged him next day morning. Other fat embolism, we saw on the table that there is a high chance of fat embolism because of BP and pulse drop, but it stabilized and we managed, we just observed him overnight and discharged him next day morning. These are 2 fat embolism what we noticed in our center. And third thing what more commonly worried about is when we do abdominal liposuction, that is tummy liposuction, injuring the inner intestines and the stomach and those kind of things. But As I explained earlier, nowadays we don't use the sharper cannulas. Blunter cannulas won't pierce the muscles. It only acts in the fat layer. So the fourth, I worried about only two problems. One is when you gain weight after the liposuction, you put on weight in other areas. So maintaining the weight in the ideal weight level is very important. Second complication I'm more worried about is the pigmentation what we see in the darker skin people, like our Indian skin. So we have lot of ways to prevent the pigmentation in the area of liposuction. Now we have a lot of tablets available to prevent the pigmentation, and we have a lot of other external methods to remove the pigment if it happens. And I think with the advancement of all those medicines and all those techniques, we are coming up with, very rarely we see pigmentation, unless otherwise we do very superficial liposuction. Okay. And last and final complication, what might happen other than surgical thing is the anesthesia related complications. But advent of the latest anesthesia drugs and like the very short acting anesthesia drugs, and they can sequence the whole surgery without giving a very long acting anesthesia drugs, I think it is very safe to do a liposuction and anesthesia. Only thing is you have to have a very good anesthetist who is well trained to give anesthesia for a cosmetic surgical procedures. Second thing is good trained plastic surgeons whose expertise is cosmetic surgery. And third thing is good hospital setup, and you should be an ideal candidate for liposuction. These four things, if the doctor, if you fit into all these four categories, obviously liposuction is the safest procedure which you can undergo safely. So looking slim and fit is not a sin, it's your right. And when diet and exercise is not helping you to get rid of that particular area of the fat, this is the solution. Thank you.